Is there a moment or story that captures what this work means to me? Sure, yeah. I tell this story. I tell this story in trainings because it means so much to me. Um, at a traumatic event, there are four active roles. There's, of course, the person who was victimized by the trauma, but there's the person who traumatized them, if it was a person. Then there's the person who came in to help, who acted the role of the savior, if there was one. And then there are the other people who were aware of the trauma and did nothing. Now, all events don't have all four of those. If I wreck on my bicycle, then it's just me, right? If I'm alone somewhere. But a lot of traumatic experiences are deeply relational, and all four roles are active. So there was somebody I worked with for many years, and um, she had had repeated intense abuse through her childhood. And there were people who caused it, there were perpetrators, and there were many people who watched and did nothing, like the social services people and teachers and neighbors. Um, and then there was her that it was done to, and there was no effective savior until she was out of childhood. So when we began working together, I had space in me for um, for her suffering. Now I had to do a lot of work to be able to kind of absorb and resonate with some of the states that she was in over those years. So I did a lot of personal work with her, getting my own supervision work. Um, and that was the main way that I focused on my countertransference, was my capacity to be in resonance with her suffering. And we worked a lot on empowering her. So I wasn't selfish about I'm going to be her savior. I wanted her to be stronger. And so there was a lot of space for, I would say, in the term of this training, there was a lot of space for the victim, and there was a lot of space for the savior. And I got my work to make that stronger and better, and she did her work, and we kept building that space out. So we did that for years. Um, and then we hit a plateau. And when we hit the plateau is when she began to tell me that I wasn't really helping her, that I didn't really care about her. And I pushed back. I mean, it's like my mother, my daughter, my partner, and her. My therapist knew all four of these women by name. I put so much time and work into this relationship. And now she's telling me that I don't care about her, that I see her, she pays me money, and I just don't get it, and I don't care. We went back and forth in kind of an argument for months and months and months. We'd been working together for, I don't know, 7 years at this point or something. And we went we just got stuck, and we went round and around on this for the better part of a year. Um, I finally found her a different therapist, and I helped her with a year-long transition to the other therapist, um, because I just thought, well, I can't go any further. So I'm learning later about these post-traumatic roles and the need in therapy for the client to integrate all four of those roles. So my client not only had a memory of herself, as a victim, but she was dreaming into who the perpetrators were. What her foster mother had been thinking. What could her foster father have been thinking? What could the doctors at the hospital have been thinking? But also she was dreaming into what could the neighbors be thinking while they do nothing? What could the social worker, what could the school counselors, what could these people be thinking? And I had created space for us to help her heal as a victim, for her to become her own savior, to become stronger and more competent. But there was no space there for me to be the person who didn't care. My whole identity was tied up with I care. So when she wanted me to be able to hold that part of the person who watched and didn't do anything, and I refused. That territory, right, in my psyche was not available to her, and she kept pushing against it, and I kept refusing. And when I realized that, I realized how I had actually really abandoned her by refusing to hold that role. I had done exactly what I was refusing to do. I had been another person who watched and didn't help. Um, and when that happened, I said, I'm going to work on this. And it became a driving passion for me in my work since then.